Welcome, everyone. Welcome to our first session of the Beyond the Diagnosis webinar series. I hope everyone's having a lovely evening so far. Today we are pleased to welcome Alison Motluk as our presenter. As a background, Allison is an accomplished freelance journalist whose work has appeared in CBC, the New York Times, The Atlantic, and many other publications. Tonight, Allison will present her investigative findings on privatized cataract surgery and broader eye care access issues, helping participants to better understand provincial healthcare coverage and avoid unnecessary out-of-pocket costs. We will have a question and answer session at the end of the presentation, so I ask that everybody please save their questions until then. When it's time for the Q&A, you can either type your question into the chat or the Q&A section, or you can use the raise hand emoji feature in Zoom. If you raise your hand, I'll send you a prompt to unmute yourself so you can then ask your question. With that, I will turn things over to Allison.
Hello, everyone. Thank you so much. I'm really happy to be here. Okay, I want to start by saying what I'm not. So I'm not an eye doctor or an eye care specialist of any kind. I'm not even someone who has had cataracts or has had cataract surgery. I haven't even helped someone else navigate cataract surgery. So I don't have any personal experience. What I am is a journalist, but I'm also a resident of Ontario who has no insurance for eye care. Obviously, you can see I do need eye care. I'm a person of modest income. I have used private health care. Obviously, I've used dental care in the past. I've used physio. I have used private health care. I have nothing against private health care. However, I might as well just admit up front that I do support publicly funded healthcare. I think that for two main reasons, it makes good sense. One is that it is the most just thing to do because everyone needs healthcare and nobody knows in advance how much they're going to need. And it's also more affordable. A lot of economic studies show that. So with that caveat, or with that sort of disclaimer, I want to say that everything I'm going to talk about today is really now that should go to the next. I'm waiting for my next slide and it's not advancing. There we go. What I'm going to talk about today is what I learned when I was writing this piece. This piece was published in January this year in a publication called The Local. So it's called How Privatized Cataract Surgery Helped Ontario's Wealthiest and Left Others Behind. In the course of reporting on that, I learned a few things. This was through interviews with patients, interviews with doctors, materials that were gathered by the Ontario Health Coalition, who were incredibly helpful to me, reading in the scientific literature, and I would just like to share what I learned. It's limited, obviously, but I found it interesting, and maybe you will too. So you have been told you have cataracts, imagine. You know, I find the word cataract challenging personally because it feels like it's a thing that has grown into my eye, some alien that has to be removed. And in fact, you know, it's your own lens has become cloudy or discolored, and you can no longer see through it in the way that you need to. The doctor, the surgeon is going to remove the cloudy lens and replace it with a nice new clear one. I like to think of it as lens replacement surgery. I personally find, I've been writing about health issues for many years, I find cataract surgery extremely complicated and very confusing. I guess the one thing that I think is worth emphasizing is that in Ontario, and I do only know about Ontario provincially, in Ontario, cataract surgery is 100% publicly covered. If you have cataracts and your doctor has said that you need to have them removed and you need a new lens, Ontario will pay for all necessary testing, the surgeon's fee, the cost of the operating room, and a replacement lens. So there's a summary. Everything that you need for cataract surgery is publicly funded. But there are two very confusing things about this. Confusing thing one, Ontario will pay for all of these things regardless of where the surgery takes place. This wasn't always the case, but it is the case now. If you have it done in a public hospital, they will pay for all of these things. If you have it done in a private for-profit facility, it will also pay for all of these things. That's confusing because just a few years ago, that wasn't true. It is true now. Confusing thing two, depending on what choices you make, it is legal for some surgeons, ophthalmologists, to charge extra fees. It's not always legal, but it is sometimes legal depending on what you choose. That is, I hope I don't make it more confusing as we go along, but those are the two things two things to keep in mind. It struck me when reading about this and talking to people that there seem to be two questions where people get that are important questions, and people get hung up on them, or people get misdirected by them. One big question: how long will I have to wait for this? And the other is the standard lens a good enough lens? These are totally reasonable questions. You have a right to know how long you're going to have to wait for this important surgery. It may be quite inconvenient to you to live your life or to do your work with the cataracts that you have, and maybe you aren't willing to wait many, many months, or in some cases in the past, I understand it's been more than a year sometimes. You may not be able to wait at all. You may be able to wait. As for the standard lens and whether it's good enough for you, maybe you want this time. Maybe you want to get a special kind of lens put into your eye. Maybe you want to minimize your dependence on your glasses. Maybe you don't want reading glasses anymore. You don't want to use distance glasses that are as serious in their prescription. Maybe you want to alleviate your astigmatism or improve your night vision. Apparently, all of these things can be offered through lenses. Let's start with lenses. Is the standard lens good enough? Is it a good enough lens? And obviously, I can't answer that for you. But what I can tell you is the standard lens is paid for, it is covered, and it has been described to me by physicians as a perfectly good lens. This is a place where some people maybe don't understand that you can go one way or you can go another way. If you decide on a special lens, it is legal for your provider to charge you for that lens. It is legal for the extra to charge you out of pocket for that lens. It is legal for your provider to charge you for certain procedures that may be associated with that lens, such as testing. There may be a lot of testing necessary. Again, I am not an eye care provider. I don't have an opinion on how much testing is reasonable, but there is testing that has to take place, and that testing can be charged to you, the cost of that. The reason for that is that once you start to get it, once you opt for a special lens, it is no longer, strictly speaking, a medically necessary lens. The standard lens, you do need a lens, and the standard lens is medically necessary and therefore covered. Once you move towards perhaps a lens that will make you not have to wear glasses anymore, that might be considered more cosmetic. So it changes its category. Note the surgeon fees. From my understanding, the surgeon fees and the operating room costs are still publicly funded, even when you opt for a lens like this. So if you choose a special lens, and that may be a good option for you, you will pay for that lens. The doctors are not allowed to inflate the price of those lenses, but they're already pretty expensive. If you look them up, as I have done, you'll find they range from a few $100s per lens to a few $1,000s per lens. But that's a choice that, you can weigh. More importantly, though, if you choose a lens like that, the physicians are allowed to charge for testing around the lens. Testing for the standard lens is covered, that you don't have to pay for, but not for the special lenses. What I was told is that testing is where a fair amount of the profit comes from when a for-profit private clinic is providing your eye care. So if you recall, you can have cataract surgery either in a public hospital or in a private for-profit facility. In a private for-profit facility, it's not outrageous to imagine that they are interested in profit. And some of the profit, if you happen to choose a lens like this, a special lens, some of the profit is going to come from the testing around your lens. One of the people I spoke to for this article was the former ophthalmologist in chief at the Kensington Eye Institute, which is it's private but not for profit. He said, because now you're outside the fee schedule, you can charge whatever you want for these tests. After my article was published, the local received an anonymous note, a note through an anonymous portal from a person who said they worked at an insurance company, and they wanted to tell me something. They said, this goes, quote, this goes much further than what appears at first glance. So the person who wrote gave me a few examples. Among them was this. They said that private hospitals pass on excess costs for tests that are not needed and sometimes not in the best interest of the patient. The example they gave, a specific example was, for example, the term IOL master fee can also be called laser optic biometry or brand name Argos Lenstar. I frequently encounter receipts that have all three, meaning private practitioners are doing the same test and billing for the same test in repetition. So what this person appears to be saying is that the private insurer will look into this, and of course is not going to cover multiple identical tests, but someone has to cover it. That's going to be the patient. This is just a by the way, but if ever you choose to send a tip to a journalist such as myself, it's always wonderful to know who the person is. Even if you don't want to be known to the public, we don't have to reveal your identity, but it's very hard to use a tip like this. I shared it with you, but I can't confirm it. I can't figure out the exact meaning of all the things this person shared with me because I can't call that person and check. Anonymous sources are always known to the reporter, FYI. They're just not known to the readers. Nonetheless, I found that a very interesting idea that maybe some clinics are actually charging for the same test more than once. And as a patient, I might not know that. And while we're here in the realm of what some clinics supposedly do to increase their profit, I do want to mention laser surgery. Again, I'm not an eye surgeon, but Dr. El Difraoui did tell me that he doesn't understand that he doesn't think that most people need laser surgery. It costs about $1,200 to $2,000 per eye. It's not covered in most cases. Dr. El Difraoui said he had studied them side by, head to head, and there was no advantage to laser. He at the time offered both. Again, I'm going to quote something he told me. He said, given that it doesn't have a benefit, does it make sense for the patient to pay $1,200 or $1,500? I'd tell them, I'll do it for you if you want to pay $3,000 for both eyes, or you can take that $3,000 and have a nice vacation after your surgery. You decide. And he said his rates went down after he explained to people that it wasn't necessary. Laser surgery is another case where, another example, I have been told, of where people are encouraged to do it, but they do have to pay out of pocket, and it's a way to increase the profit margin of private clinics. But these are fair questions, you know. Which lens do you want? Do you want to do laser? These are fair questions. The one thing I would say is that we should all be cautious about asking people who might have a strong financial incentive to encourage me to get special lenses and to use lasers. Maybe those aren't the right people for me to inquire from about whether it's needed. And this is somewhere where I wouldn't mind pausing for a second, because I think that in most cases in Canada, when you're a patient, you're just a patient. But in a few instances, there's a kind of a blurry line between whether you're a patient or a consumer. And I think that because we aren't used to this, we often find ourselves at sea. You know, my dad had heart surgery, cancer surgery, knee replacement surgery, and at no time were we asked, did we want a better stent? Could the stitches be better? Do we want to pay for a special joint? We weren't asked those things. And I don't know what we would have said had we been asked, because we were able to just trust the surgeon and the physician to make the best decision for us, given their knowledge. That's how we normally do healthcare in Canada. And so the idea that you might have to be suspicious to some extent of your physician, I think is really difficult for us. A lot of my work has been done in the fertility field, where this is also very evident. So it is interesting to me, when I was doing this piece on cataract surgery, to see the parallels in the way things were upsold and the way people were made to feel quite anxious about not choosing the more expensive or better option. Okay, on to the other question that is very important to this very important in terms of what happens to you, whether you will pay or not pay for your cataract surgery. How long will I have to wait? Again, this is a very, very fair question to ask. My understanding is that at times in the last decade or so, there have been extremely long wait times, many months. Some people were even made to wait more than a year. I personally feel that's too long. Our eyes are very important to us. That said, most people don't need to have it, are willing to not have it next week. Most people are willing to wait a month or 2 months or 3 months. But how do you know? How do you find out what the likely wait time is for you? Again, I'm going to say probably not from people who could benefit financially from misleading you. There is the Ontario wait time tracker. I don't know if everybody's already seen that. This is just an example. I went in today. Sorry, I'm going to look on this screen. So you can see the Ontario provincial average is about 86% of the time they meet their standard that they've set for themselves. And I guess the standard that they've set, there are different categories of patients. There's it's the priority 2 patients have to be seen very quickly. Then the 4s can take longer. And then along the bottom, you can see how they're actually meeting or not meeting that. And in this tool, you can actually go to individual facilities and hospitals and get information on how long you're going to have to wait. Now, I will say it is very confusing and time-consuming to use this tool. It has, you'll notice it says overall wait 1, because there are 2 wait times that they measure. One, I believe, is from the time my doctor tells me I have cataracts until the time I get to see a surgeon. And the other wait time is, so that would be what you're looking at here. And the other wait time is from the time I decide I want to go ahead and have surgery to the time I have surgery. So there are 2 wait times, and they're tracked throughout the province. I will say that I have noticed a couple of, when I was looking at it during the writing of this article, there were some glitches where the data were not correct. Maybe that's fixed now. But it is not a bad tool. it's time consuming and confusing, but it is helpful. I personally would use this tool if I had to decide where I wanted to have my cataracts done. But it looks like just to get from my, if I was a priority 4 patient, it could take me 182 days to just meet my surgeon. I would also do other things. I would obviously I would speak to anyone I knew who'd had cataract surgery done about their experience. And I also have been interested to notice that there are Facebook groups dedicated to this topic. And judging by how useful I find Facebook groups in other health, specific health categories, I personally would probably join and ask questions there or any other place where people gathered to speak about their experiences. It is important to understand wait times. And the reason that it's important, one of the many reasons it's important, including how long it might take you, is that wait time horror stories are used to lure people into private pay options. So in the article that I wrote, I spoke about a couple of people. One of them was a 54-year-old man who was the main breadwinner in his family. He was told by his eye doctor that he needed to have surgery urgently. He had had a bad experience already with joint surgery with a very, very long wait. So when his eye doctor mentioned that, and also I think the ophthalmologist mentioned that going through the public system would take a long time, he was already primed for that and was quite nervous about that. He did not want to have to take time off work. His doctors, the physicians that he spoke to, at no point offered him a fully covered option. But we talked about it at the very beginning. Cataract surgery is fully funded in the province of Ontario. This was not an option laid out before him. He was channeled from his optometrist into an ophthalmologist in a private clinic. And they gave him a number of options, all of which were going to cost him more than $1,000. The one he landed on, I can't remember exactly now, but it was in the range of $6,000. He ended up getting 2 special lenses that cost $820 for both of them, for 2 of them. The diagnostic tests cost $2,460 for the tests. And then he opted for laser because he was told laser was the best. That was $2,400. So he paid that out of pocket. Of course, Ontario paid for his surgery and they paid for his OR. Another woman who I interviewed for that piece was 83, living on a fixed income. Her optometrist told her that she needed cataract surgery and also warned her that it would be more than 2 years wait. She didn't want to wait that long. She had told me that her husband had eye problems and they had really noticed how it affected their lives, and she didn't want to wait 2 years. So she borrowed money and she went private pay, and she spent $6,990 for the lenses and the tests and so on. Later, she learned from friends that 2-year wait time was not true. The friends who had been diagnosed at the same time and went through the public system had only waited a few months and they got their surgery. And she said, quote, "I could have waited 3 months. I could still drive." So it is very important to try to get accurate information about wait times, not to necessarily believe what you're told by a clinic that may have a reason to want you to choose them over the public system. That said, when we look at what's here on the wait time tool, it isn't it's not that impressive. Of course, this isn't, I live in Toronto. I didn't look for Toronto for myself, but the province is not that impressive. I want to share something else that didn't make it in my article, but I felt was really important work done by the Ontario Health Coalition. In the autumn of 2025, they systematically called and recorded the calls. They called private for-profit eye clinics that offered cataract surgery in different cities in the province. And they posed, the people calling posed as the child of an elderly patient. And the elderly patient needed very straightforward cataract surgery, no special lenses of any kind. So some of the clinics they discovered were openly selling queue jumping, which is not legal in this province. I think I actually have this one, sorry. Let's see. Yeah, so here's this one quote. This is what was told to the person they're calling, pretending to be the child of an elderly person who needs cataract surgery, and they want to know how much will it cost, what will it be like, what can they do. If you want to go private, it's much quicker. There's no wait. You can literally get from consultation to surgery within a couple of weeks. But you're looking starting at $2,900 an eye up to $4,000 an eye. Another person, sorry, I didn't write this one down, but another clinic said, if she can wait till OHIP and she can't really afford, I'm not saying that, a lot of people opt to come here because they want it done quicker. Several places, they did multiple places, and many places basically said, if you go private, we will go fast. It's not allowed to offer it's not allowed to offer quicker service if someone pays for some component of the service, because cataract surgery is supposed to be offered fully funded in the province. They also discovered a lot of other kinds of misinformation given out by clinics, private for-profit clinics. They sometimes described two separate pathways to cataract care. They described one as an OHIP route, another as a private pay route. And some of them made it sound like they were going to charge for the cataract surgery. And again, it is not legal to charge for a medically necessary medical service. So this one said, there's a couple different ways to go. You can either go private, which you're going to pay out of pocket, or you can go OHIP, which you're going to be waiting a while. Or another clinic said, it's $1,000 an eye. Then it's plus the measurement, plus whatever the lens you choose. Another one said, so if she goes to her optometrist and she says, I want to pay privately, then she can call here and make an appointment. So I am grateful for their work. I think this tells us a lot about how easy it is to become confused when you're seeking treatment. Again, I'm going to reiterate that in Ontario, the province will pay for all of those things, the surgeon, the lens, the measurement, the OR, even if it's provided in a private for-profit facility. One more example of something that is not allowed, place is not allowed to tell you that you must buy something in order to get the service. So in this case, we don't offer services just to remove cataracts. We offer it with custom vision correction. You're not allowed to make it conditional. It's a medically necessary surgery. Or another one said, this is incredible. Actually, it's completely not true. Since cataract is covered by the government, they prohibit private clinics from treating cataracts unless patients have another issue that can be treated at the same time. The cataract will be free and she'll only pay for the other surgery. That's not true, of course. But I think it's very clear how easy it is to become confused. Believe me, I struggled with understanding what was going on, what was allowed, what is not allowed, when and how. Let me just say a word or two about the backstory, about how we got here. I'll start by saying again that there were times in the last 10 or more years where the wait times were extremely long. And some people, in order to not have to wait that long, decided that even though they did not need or want a fancy lens, they were willing to pay for a lens in order to get quick cataract, to get their cataract, their bad lens removed and another some good lens put into their eye. And there was a time when that was, there were people making that choice. I will say things got more confusing in 2020. In 2020, if you recall, we had the pandemic shut down a lot of our operating rooms in the province, and there were backlogs in every kind of surgery. And one of the things that the Ford government decided to do was to allow life-saving surgeries to take over the ORs. Back when the ORs were coming back online, and they wanted to clear some of the backlogs, hospitals and public facilities prioritized life-saving surgeries, cancer, heart, and so on. And Ford moved a lot of cataract surgeries out of hospital settings and into private facilities. And he agreed to pay for the overhead. So until that time, private for-profit facilities were paid for the surgeon was paid, but the overhead was not paid. So there was no facility fee given to them. The only reason that they would do it prior to 2020 was that they would make a little bit of profit on some other element of the surgery they were doing. But in 2020, actual 100% publicly funded cataract surgery was taking place in private clinics. And then in 2023, Ford passed a law that said that that will continue. So it was no longer a matter of just clearing the backlog. We're now going to use this as, this is going to be one of the ways we're going to do cataract surgery, both in public facilities and in private for-profit facilities. They paid an overhead payment, interestingly, that is a little bit higher than what they pay for the public hospital, even though hospitals tend to take more challenging patients. But the idea was, Ford said, and the government said, they did not want this backlog to continue to be bad or to get worse. They wanted to clear the backlog, and one of the ways they were going to do that was by paying for fully funding cataract surgery in private for-profit facilities. A study in the Canadian Medical Association Journal in 2024 found that, unfortunately, this didn't really have the desired result of bringing more cataract surgery to all people equally in the province. In fact, what they found when they ran a lot of numbers, did a lot of analysis, was that this moving of money into the private for-profit clinics actually resulted in the wealthier patients having more cataract surgery and poorer patients having less cataract surgery. And no one knows exactly why, but there was speculation that it might have had something to do with the fact that in addition to getting paid for the surgical time and the operating room costs, wealthier patients were more likely to also opt for special lenses or other kinds of special they were more willing to pay for the testing and so on, laser surgery, et cetera. And so they were able to prioritize the patients who were going to bring a larger profit. That has not been, that's what the authors speculate, but has never been proven to be why this happened. But what they did show was that wealthier patients got more cataract surgery, less wealthy, lower income people got less. I do want to show you this. This is a page on an Ontario government website. So, I use the term private for-profit facility. I just think that's very clear. A private for-profit facility that does cataract surgery is a place that is run privately. It's not a public facility, and it is interested in profit. The government calls them community surgical and diagnostic centers. The important things to read here, this is the Government of Ontario website saying these things. It is illegal for centers, these surgical and diagnostic centers, to charge you for services that are insured by OHIP. Okay, that's what we've been talking about. It is illegal for them to charge you for preferential access to OHIP insured services. In other words, to suggest that if you pay X, you will get here, we will provide this service, or only if you pay X will we provide this service. It is illegal to be charged for the facility fee, and so on. If you Google OHIP insured services at community surgical and diagnostic centers, you will eventually find this page where they say that if you think you might have been charged incorrectly, you can lodge a complaint, and they say that they will pay you back. I don't believe that's ever happened. I believe that one of the MPPs I spoke to had looked into it, and there has not yet been a case where that a person has been reimbursed for money that was wrongly charged. But the Ontario government is clear here that they don't approve of this kind of behavior that we've just been talking about that is occasionally happening. So as a reminder, Ontario does cover the full cost of cataract surgery. Your facilities are not allowed to charge you in order to queue jump. They're not allowed to, they're supposed to make all of, cataract surgery is supposed to be equally available to anyone who's eligible for it. Shouldn't be just the people who are willing to buy the special lenses and so on. You're not allowed to make extra charges mandatory before you offer the surgery. You're not allowed to offer conditions. It's not allowed to be queue jumping. We are seeing these things, but they aren't legal. Just before I wrap up there, I would like to say there's two things I would love to see that would help just a bit. One thing would be to make sure that the wait time tool or wait time tracker is easier and reliable. I would like it to be double checked, all the data to be double checked, and maybe it could be made a little more useful in terms of predictive values because it only casts back. I think that would help a lot. But even more important than that, we need a central list. We need a list so that when my doctor says that I need cataract surgery, my doctor puts me on a list, and that's where I'm prioritized. And then I can be assigned to a clinic that is taking patients, rather than each clinic having its own list that it can then prioritize people who may or may not be willing to spend a lot of money. If we're going to use public money for cataract surgery, it should be fairly distributed. And a lot of the people I spoke to have talked about central lists. They are used in other types of medicine in the province. Last time I checked, bariatric surgery was by central list. This would help a lot to speed things up and make things more fair. I'm going to stop there and open it up to questions. That's my email address. I hope I can help with the questions, but I will say, although I do write a lot about health and the economics of health and different and the science of health, I'm not an expert on cataract surgery, as you can probably already tell. I'm very interested in it. I'm interested to hear your questions, but and I hope I can answer them.
Okay, thank you so, so much, Allison. That was very informative and beneficial. I'm sure everyone else agrees. So, as I had stated at the beginning of the presentation, if you want to ask a question, you can either type it into the Q&A box, you can type it into the chat, or there is the reaction. You can put the raised hand reaction, and then I will prompt you to unmute and you can talk. Okay, well, in the chat, Ferryman Dariani says, thank you so much for sharing your experience. Okay.
You're welcome.
Oh,
Thank
and
you.
there's a question. All right. Okay. So this question is, it says, that was so interesting. Thank you. From your research, what have been other ophthalmologists' perspectives on these private clinics charging for extra lenses and services? Are some on board?
Oh, for sure. I think some are on board. Absolutely. I think there are many ophthalmologists who believe that some of these lenses are actually what you need. So I don't want to make it sound like I don't want to make it sound like there's no one who ever could benefit from these lenses. So many ophthalmologists feel very good about being able to offer you a lens that might take away another kind of problem for you. So I think, I know people, knowledgeable people who were not duped, who made the choice to get lenses that had correction in them. I know that they knew what they were doing. So I mean, that's a good thing. If that's the kind of lens you want and it's going to help you and it works for you and you have the money, that's great. The problem comes when you don't understand that maybe in some instances the standard lens is actually a better one for you, and that by not choosing it, you're paying money for something you don't need. That's the problem. Not that nobody ever needs the special lenses. Some of the special lenses are actually apparently very good for some people.
Okay, thank you for that. And that's answered. All right, are there any other questions? Don't see any raised hand emojis. And Mock just wants to say thank you so much for this valuable information.
Thank you.
All right. It's very important, especially with the wait times. I definitely agree that that's something that we should understand.
And also maybe we should be complaining about. I mean, a solution to the wait times isn't necessarily to go private and pay money. It maybe is to change the way we're offering the surgeries. Maybe we need more money, more funding to provide Ontarians with timely access to cataract surgery. This is like the number one surgery. I think it's the number one surgery in the most common surgery in the province.
It's common, exactly. And Amanda. So Amanda wanted to say the information from the Ontario Health Coalition was super interesting. Did they release any statistics on the number of clinics allowed for queue jumping?
The number of clinics that
that allowed queue jumping, yes.
I don't think they would be able to make a statistical analysis. And I don't actually know what they've done with this information because I got it from them maybe in December last year. I don't know if they've gone on to publish it or if it was published, but I think what they did find is that of their sample, a very high proportion of the clinics they called did suggest that by going private, they could get speedy eye care. And of course, for my person I wrote about in my article in the Local, that certainly was the case with him. He was treated within 2 weeks, I believe. His first eye was done within 2 weeks of referral. So that part might not be a lie.
One last question. Are you planning to do more investigation on this in the eye space, especially as the talks of privatization increase?
I would love to. I think I remember when I was writing this that there was a lot of material that I felt needed to be followed up on. I guess the question is, I'm a freelancer, so the question always for me is who's going to take the story, who wants to publish it. But yes, I'm very interested in the private public intersection, and it is of great interest in eye care. Yes. So perhaps I will be publishing another piece on this.
I am curious, what are your thoughts on optometry and its role in this?
Yeah, that's a great question, actually. I don't know anything specific, but I am very interested. I certainly have heard that sometimes optometrists do preferentially pass their patients on to private for-profit clinics as opposed to public. And maybe there's something interesting there. I don't know. I think that it's interesting that someone like me, for instance, in order to even be diagnosed with a cataract, has to go private. Like I have to pay my optometrist to care for my eyes right now. So right from the get-go, we're talking about private care for some people. So I don't know. I wouldn't want to. I wouldn't want to suggest that there's a kind of anything nefarious happening, but I think it would be great if I didn't have to even wonder.
Okay, thank you. Okay, Well, if anybody does have any questions that come to mind after the presentation, feel free to submit a email to Allison. She had provided her email there, but we are going to include it in some information afterwards along with the recording. So yes, I feel free to send questions to Allison. If you have any questions also on our end, you can submit it directly to us at ccb@ccbnational.net. And we'll be more than happy to forward it to Allison and she can answer it from there too. Okay. All right. Oh, and Amanda says, thank you so much. Really great work.
Thank you so much. It's been I'm really glad to have spoken with you tonight.
And a recording of tonight's session will be posted on our website soon. Just to let everyone know, our next session will take place on Monday, July 13th at 12 p.m., featuring presenter Anne Mock. So we hope everybody will be able to join us then. Well, thank you, everyone. So I hope you have a great rest of the evening. Thank you so much for attending our first session of the Beyond the Diagnosis series, and we look forward to seeing everybody at our next.